Hei, tämä on syytä tietää. Suhtautuminen koronarokotteisiin on aika mielettömällä tavalla kahtia jakautunut. Tosiasiat ja terve järki puhuu vaarallisuuden puolesta ja tunteet puhuu ihan muun puolesta. Virallinen taho ja media tuntuu olevan aika tunteikas. Ne pitävät edelleen yllä uskomusta turvallisesta, tehokkaasta ja ilmeisiä tosiasioita ja tervettä järkeä salaliittoteoriana. EU:ssakin on jo useamman kertaan puhuttu salaliittoteorioita. Nyt jälleen 12. lokakuuta.
Well, hello everybody. I'm John Laughlin, Director of FVD International, Forum for Democracy International. We're in the European Parliament today. I'm delighted to welcome as my guest today Marcel de Graaf, Member of the European Parliament for Forum for Democracy, Joachim Kuhs, Member of the European Parliament for Alternative für Deutschland, and Willem Engel, who is a campaigner and chairman or president of Virus Truth, Virus Wahrheit, which is a pressure group that campaigns on the issue of vaccines and COVID-related policies. We are discussing today the letter which Marcel de Graaf, Joachim Kuhs and other members of the European Parliament have written to the European Medical Agency. In this letter, which is a 20-page document or so, very densely argued, and which I encourage our viewers to read. You can find it on Marcel de Graaf's website, and also there's a link to it from fedinternational.com.
Marcel de Graaf on lähettänyt kirjeen EMAan eli Euroopan lääkevirastoon vaatien koronarokotteiden myyntilupien perumista. Hän kertoo syyksi sen, että luvat ovat käytännössä laittomia. Kuunnellaanpa asialle perustelut.
There are a number of arguments made in favour of this appeal to withdraw the vaccines. Some of the arguments concern procedures, procedures which were either not followed or which were deliberately violated or changed in advance. Other arguments concern the use to which the vaccines have been put, allegedly wrongly. There are also arguments concerning the harmful nature of the vaccines. And even arguments concerning alleged confusion between the batches which were used for testing and the batches which were actually used on people.
Näitä perusteluita myyntiluvan laittomuudelle on jo pari vuoden ajan pidetty sensuroitavana. Jostakin näistä seikoista olen itse kysynyt Fimealta ja varmasti moni muukin. Vastauksia ei ole tullut. Tai vastauksissa on vedottu nimenomaan EMAan, eli tähän paikkaan, johon mepit tiimeineen ovat nyt lähettäneet kirjeensä.
This approval and the way we got to this approval is also completely messed up. And messed up in a way that really shocked me, because if you approve a batch, a certain vaccine or certain medicine, then you expect that the medicine that is approved is the medicine that is applied to patients or to citizens. And if there's a difference between that, then you are basically being vaccinated with a non-approved.
With something that wasn't approved.
Whatever substance. So, well, that really shocked me, and that was why I was so.
Tässä pöydässä näkyy jälleen sensuuri ja hengenvaarallinen vaikutus yhteiskuntaan. Nämä ihmiset ovat päättäjiä, meppejä, ja he ovat olleet asioista pimenossa. He puhuvat tässä asioista, jotka ovat näkyneet vain niin sanotussa vaihtoehtoisissa medioissa. Kun päättäjät ovat hiljalleen heräilleet siihen, että jotain on vinossa, heidän on kysyttävä asioista ei viranomaisilta, vaan aktivisteilta, kuten Willem Engel.
I got a copy of the letter that Willem sent to the Dutch medical agency with a lot of the same arguments as that we used in that letter, because I contacted Willem and I said, well, we like to use your letter as a concept and we had to rework it, of course, because we have a completely different legislation.
Meppi Marcel de Graafin yllättänyt asia on hengenvaarallinen, laiton, koskee miljardeja ihmisiä ja silti sitä käsitellään vain podcasteissa. Tässä John Campbell haastattelee tohtori Josh Kuetschkovia Israelista.
Nobody was told that they're actually getting a product that is different than the one that the clinical trial was run on. And so what that means, essentially, is that nobody could have given informed consent because they were kept in the dark about this, right?
Kyse on siitä, että Pfizer-yhtiö on käyttänyt kliinisissä kokeissa eri valmistusmenetelmää kuin rokotteen massatuotannossa. Eli käytännössä EMAn myöntämä myyntilupa ei koskisikaan sitä tuotetta, joka eurooppalaisiin käsivarsiin on tuikattu.
enthusiastic about the action of Willem, and that I said, well, we need to take this to a much higher level. We need to take this to the European level because every European citizen is being exposed to something they shouldn't be exposed to.
Epäselvyydet alkavat nyt toivottavasti paljastua päättäjille ja ehkäpä joskus mediallekin.
Because we already know a lot of things about these COVID vaccines. We know that they're not effective. I mean, if a vaccine is effective, then why got 4 of them or 5 or whatever? Because they still don't work after the first time. So that we knew that already, and we know that the details on the contracts are not given to the public. So it's all with secrecy and hidden SMSs and money going to places where we don't know if it's used well or not, taxpayers' money. So we already had an idea that this whole thing was messy and in some way corrupted.
Korruptiota EU:ssa. Miten se on mahdollista? EU-rakennukset ovat valtavia. Käytäviä, koloja, ohjelmia, osastoja ja projekteja riittää. Ehkäpä siksi Euroopan mepeille omassa talossa tapahtuneen korruption laajuus alkaakin valjeta vasta nyt. Emalle tehdyn kirjeen on allekirjoittanut 8 oman talon korruptio herännyttä meppiä.
That he prescribes. What led you to sign this letter?
I think it's many things. As Marcel said, there are so many things which are going really wrong in a very big scale. Therefore, it's so unbelievable what we find. We look on one aspect, and then you find fraud or something else, something really. So hindrances and big mountains, you cannot surmount them. Yeah, you cannot go. You must go outside of them and beyond them. And therefore, it's so many things which are really stunning and stunned me. It began at the beginning. It was in the first year when the things went wrong, and it didn't change. And I, as a member of the parliament in the committee of budget and budgetary control, I was very much involved with money. It's a money issue, you know, and it went wrong so wrong for me as a very frugal person who thinks you must pay for all things, and now they have billions of euros throwing to the pharmaceutical firms about money, about things which are not proven, which are not safe, and which are say for themselves say we cannot say it's safe. Yeah, and that was for me. It was an enlightenment when the one of the directors of Pfizer told the committee who was looking into it that she said, we didn't know it, and therefore we have no proof that it is safe.
That's right.
That's so insane. And
It's insane, hullua. Ehkäpä tärkeäkin työ ihmisten terveyden hyväksi voi mennä vähän hulluksi, kun täytyy tehdä kiireellä, niin kiireellä kuin tieteen nopeudella.
And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunization before it's entered the market? No. We had to really move at the speed of science.
Willem Engel on yksi varmaankin tuhansista, ellei 10 000 aktivisteista maailmalla, virallisen linjan mukaan disinformaation jakelijoista. Tässä hän kertoo EU-parlamentin talon sisällä sen, mikä on pari vuotta ollut salaliittoteoria.
Are they safe or are they dangerous? You claim they're dangerous.
They're clearly dangerous because they did not follow, and one of the procedures that was overlooked or fast-tracked, it's called a major objection, and it has a lot to do with the good manufacturing practice. That says that you have to have the procedure down to the minutiae, so you know that the product is always the same wherever you produce it and whenever you produce it. That was clearly not in order, and that probably has led to the differences between those batches. So some groups of batches have a very high incidence of adverse effects, but you do not know beforehand which ones. So the precautionary thing here to do is to say we have to regard all batches as unsafe.
Yeah.
So that's the first thing. And you cannot change it to say, well, only 4% of the batches is unsafe, so that's an acceptable risk.
And why are the different batches differently dangerous? Or
so
why
we're talking about vaccines erroneously. This is a new platform.
Yes.
It's an mRNA platform which technically and scientifically and also legally is considered advanced medical therapeutical products. So in a sense, it's gene therapy.
Yeah.
Now, the scale it has been produced has also never been done. The adjuvants that were used has also never been done. So this is a worldwide experiment. We are the guinea pigs. There's no going around it. It's an experimental gene therapeutic product that was fast-tracked by changing the rules, bending the rules, and trying to cover up those changes in the directive of 2021 on the 24th of March. And what you see there is on every level a little bit of tweaking the process so you get a completely unapproved, completely unsafe product on the market.
Miten näin voi olla? Miten tämä kaikki voi jäädä huomaamatta? Ehkä siksi, että tiedottaminen uusista rokotteista ei ole aivan vastannut niiden monimutkaisuutta ja riskejä. Tiedottamisen laatu on ollut tätä.
Oletko rokotettu?
On. Se, että jokainen ikinä on ottanut rokotteen, niin se on hyvä juttu. Jokainen pääsee menemään mihin vaan. Mulla on syysloma. Jos mä haluan lähteä johonkin, mulla on molemmat rokotteet, mä pääsen lähteä.
Koronarokotteiden nopea kehitys on ollut mahdollista valtavien resurssien ansiosta.
Oletko rokotettu?
On. 2 rokotusta.
Ootko ylpeä?
Kyllä. Kun fuck tää shit, että sä oot anti-vax.
Mitä mieltä sä oot tosta, kun jengi heittää just jotain, että ne laittaa sirun suhun ja jotain tällaista shit.
Tutkimusta ja arviointia on tehty rinnakkain, ja koronarokotteet ovat käyneet läpi samat vaiheet kuin muutkin rokotteet.
Biologia, niin kuin virushan haluaa olla, tai siis sehän on hyvin yksinkertainen, se on se pallero, se on piikkiproteiineita.
Et sitten kun se pallero, se pikkupallero, golftiine ja muinen, se tupsahtaa siihen solun pinnalle.
Mä en tuolle rokotettu, mä en oo rokotettu.
Mikset?
Mä en usko tohon.
Sä et usko rokotukseen?
Joo, mä en usko. Toi korona on vaan rahastus. Sä tiedät se itsekin. Oot sä rokotettu?
Joo, mulla on 2.
Älä puhu paskaa.
Terve skeptisyys määriteltiin uudestaan. Siitä tuli rokotevastaisuutta. Ja sokeasta uskosta auktoriteetteja kohtaan tuli skeptisyyttä.
Ottakaa se rokote.
Mulla on molemmat. Eli te ootte silleen rokotteen puolesta?
En mä sitä vastaakaan ottaa mitenkään, mutta otin se vaan totta kai silleen, kun kaikki muutkin taas. Sehän on niinku silleen...
Eli sä liikut massan mukaan?
Niin, no periaatteessa joo.
Tuleeko susta zombi, jos sä otat rokotteen?
No ei todellakaan tule.
Ei tule.
Totta kai rokotteisiin liittyy haittojen mahdollisuus. Ja niiden kohdalla niin meillä on nollatoleranssi silloin, jos ne haitat on tosi vakavia.
Nollatoleranssi kuitenkin unohtui. Kun kertomus rokotteista oli tätä tasoa, ei ehkä ole ihme, että päättäjienkin on ollut vaikea ymmärtää omia lakeja. Ehkä siksi vasta nyt päättäjäkin alkaa käyttää kovia sanoja, kuten de Graaf.
Now, if you start changing these procedures to push through something that's experimental, then you can start asking questions. Where were all these millions used for that were paid to Pfizer and Moderna? Why are all these officials who are doing their jobs for decades in a very decent way certainly open to change all these rules and to bypass all these safety measures? Because that's what these procedures are for. They're safety measures. They're
safe, of course.
And they're for our safety.
Yeah.
That's why these measures are there. And then you put them aside because of some experimental stuff that you, in a very high speed, want to pull through this process to inject into people, then something is really, really wrong. That's what...
Aika hermostuttavaa. Aihe on sellainen, joka ei oikein sovi puhuttavaksi EUn siistillä käytävällä pukupäällä. Ursula von der Leyenenkin korruptiota epäillään.
The word corrupted, there is the word corrupt, and there is the allegation, is there not, that Ursula von der Leyen suppressed her text messages with the head of Pfizer, if I'm not mistaken. Would you like to tell us where we are on that? Have they been released, these text messages? Have they disappeared? And more specifically, is it corruption, not just corrupted?
that must a judge, a court must decide on that, and therefore we
but
wait.
a political accusation can be made. Yeah.
Yeah, sure, but therefore we wait for that EPPO, the prosecutor office in Luxembourg, will go on and with this case, because Ursula von der Leyen has their case still open, and many cases, as I heard. But we didn't hear anything about the ongoing of this investigation. And therefore, I am, as a political and as an MEP, I am sure there will be no result, even not before the election next year.
Yes.
And therefore, it's only to feel the people feel safe, all things are working, all systems are working, and so on. But they are all working together in some sense about, and it's corruption in the political sense. It's really corruption, I'm sure.
Korruptiota, mutta mitään siis tuskin tapahtuu ennen kuin pukki poistuu Kaalimaalta.
For me it began with the origin of SARS-CoV-2. The origin of SARS-CoV-2, I think, is the biggest fraud, the biggest.
You mean the lab? The lab theory,
the lab
course,
things,
exactly.
Sure. It's really the biggest cover-up in medical history.
Yeah.
What are they doing there? And therefore, it began with a fraudster system, and it goes on with a corrupt solution. It's a solution which we didn't need. Yeah, and. If we are going on and on and on with such things which we don't need, I was never vaccinated with these mRNA technologies, and I'm happy about that. And I think the solution will be more people must see also that things are really deteriorating. They are going wrong and worse and worse, and then they will wake up, and then they will say, no, never more, any more vaccination.
Miksi meidän turvallisuudestamme huolehtivat viranomaiset eivät ole tehneet mitään? De Graaf selittää.
All these institutions is that they cover each other.
Yeah.
They're covering for von der Leyen's SMSs. They're covering for this conditional approval. Now we get this prolongation.
Yeah.
It was addressed by Willem in the Netherlands. How can you prolong a conditional approval if you have all these data about adverse effects? The same question that we were asking at the EMA. The answer to Willem is, well, you have to go to the EMA. You can't ask us because we are just doing what Europe is asking from us.
Yeah, and that's why you've addressed this letter to the EMA.
But they are responsible in the Netherlands for the safety of the Dutch people.
Yeah.
And the EMA for the European people. So you see, they're pointing to each other.
Exactly.
No, he is responsible. And that is also part of this network of covering each other.
Vastuu kiertää kehää. Kun vastuuta ei kanneta, joku tietysti ottaa ja käyttää sitä hyväkseen. Willem Engel näkee tämän kaiken taustalla suuremman kuvion. Euroopan komission hiljaisen vallankaappausyrityksen.
What we see here in this case of the injections and the whole COVID case, you could say, this is an usurping of power by the European Commission. By trying to circumvent Parliament, by trying to create pseudo-laws, they're now usurping the power of health. The whole EU for Health program, which is based on the One Health ideology, is really scary. If we look to the WHO treaty, this is an exponent of what's actually happening here in this house or next door at the Commission. So by trying to answer this letter that we wrote to the Dutch version of the EMA, and their answer was telling, they said, well, we do not have the authority, you have to go to Europe, which is untrue. In all this European legislation, it clearly states that the end result, or the person that is ultimately responsible, is the sovereign state itself. And that is a thing that is very worrisome. That with this COVID narrative, the sovereignty is taken away from the states even more.
Yeah.
And that's why I'm so happy that now we have a pincher movement in that sense, that we do it on a national level and a European level, because Now they have to keep pointing towards each other, and we are starting a law case, a court case against them as well, because we want answers.
Yeah.
Euroopan unionin sisällä näyttää siis kuohuvan sekä korruptiota, vallankaappausta ja tervettä kapinaa, byrokratian ja monimutkaisen lainsäätelyn keinoin. Päällisin puolin kaikki näyttää siistiltä ja hyvältä. Joachim näkeekin ongelmana sen, että ihmiset uskovat systeemiin kenties hieman liikaa.
I think in Germany we have a big problem about that the people believe in the state very, very strongly. Yes. And therefore it's a long way to collect all the persons who are willing to oppose the system. Therefore I hope for these things that we from the European level or from the Dutch level can help them, to convince them to be more outspoken, to be more frankly and confident to oppose the government.
Näin. On syytä tietää, että kakku voi näyttää päälle päin hyvältä, mutta sisältä ei. Ja jos välillä ei tarkista, mitä tapahtuu, niin kissa voi päästä pöydälle. Nyt riittää sanalaskut. Kiitos tästä. Ja jälleen muistutan, että teen tätä tiedotustyötä vapaasti ja itsenäisesti ilman palkkaa. Jos haluatte tukea työtä, niin se voi tehdä linkistä tuosta alta. Kiitos.